Okay, I'd like to call the meeting of the Humboldt County Board of Health to order at 9 o'clock on Thursday, April 30th. The first thing we will do is have a roll call of the County Health Board. We'll start with Dr. Stringham,
Here.
Mr. Mendiola,
Here.
Sheriff,
I'm here. Good morning.
Commissioner Brizenden,
Here.
Commissioner French,
Here.
Commissioner Bell,
I'm here.
and Commissioner Cherry is absent today. He won't be in, so. We'll move next to the Pledge of Allegiance. Put the flag up, Dave, and will you join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Justice for all.
Thank you. We'll move on to public comment. And do we have any members of the public that would like to make a comment? At this time, unmute your mic and we'll take your comment.
And just remember, Mr. Chair, that anybody who is not on the Teams application, it's *6 to unmute your phone. And of course, when you're done, it would be *6 to mute yourself again. I do have one. Patricia Tyndall, are you on the line? Remember, it's *6 to unmute.
I think I hear her.
Is that you, Patty?
Yes, it is.
Very
Okay.
good. We're at public comment.
Okay, Dave wanted me just to give some information about our Homebound Meals program and other food deliveries that we've been doing. So I wanted to let you know that we are delivering hot meals 5 days a week. Our Homebound Meals program is continuing as normal, but we have been adding a lot of homebound, COVID homebound individuals. So we are up to about 70 families that we're delivering meals to every day. And we do have room in our trucks for about 20 more. And then after that, we've reached our delivery capacity. But we can try to work out something, if we need to continue to add people. We are also delivering other food items. So we've gotten like eggs and coffee and bread, bananas, fresh fruits and vegetables from the mobile harvest. So every time we work up with the mobile harvest and the Northern Nevada Food Bank, we try to get their fresh fruits and vegetables, anything that's left from the food distribution, and we package it in bags and take it to the homebound. So they also have some fresh food on hand that they can supplement their hot meals with. We did have the food bank mobile harvest. It was on Monday. It was out in the parking lot at the event center. It was pretty hot. We served about 156 vehicles came through the line. It was a vehicle delivery, and many of those vehicles are new customers or new clients, and a lot of them were picking up from multiple family households. So there was a little bit of an uptick in the food that we were providing with Northern Nevada Food Bank and the Winnemucca Food Bank. And by the way, I need to say thank you also to Humboldt Hospice, who sent some volunteers out to help us pack the boxes and bags. While we were out there, I also have been printing off information from the CDC. I'm sure everybody is familiar with that website. They have great information. I also use the Washoe Board of Health that puts out information. Nevada State Health Department and their Environmental Health Department have put out tons of information. They've got videos and things on like how to run your business and how to run your kitchen and new OSHA standards for meal preparation and stuff like that. So I printed out some flyers on just regular COVID-19 information for people. I printed out information on households living in close quarters. Yeah, a lot of those.
And now, I mean, from the staff that we.
Yeah, a lot of the folks that come to the food bank had cars packed with people. I'm sure they live in closer family homes. And I also printed out a lot of information on how to protect yourself and others, and also what to do if you're at higher risk. That's mostly for my older folks. And we handed that out to all the cars that were coming in. And then the last thing we did that I was really happy with, so we've been making masks, and I've been making them, and they're pretty crappy. I'm not much of a seamstress. My mom's been making them and mailing them to me from New York as well. And we wanted to make sure all of our volunteers had masks and gloves, of course, and were 6 feet away, social distancing. But I also wanted to make sure that the people in the vehicles who come to pick up the food, that they had access. So we gave out about 102 masks just randomly to anybody in their vehicles. We ran out. There were more vehicles that we had masks for. Some of them were made out of paper toweling and rubber bands because that's what we had. So I think it's important for them to be wearing them and social distancing, and know not to pack your whole family into your car like what Dr. Stringham said. A lot of people were asking about them after we ran out, so I gave them Dr. Stringham's phone number because they said they didn't know how to do Facebook or whatever. But anyway, that's what we've been trying to do, just to get some good information out there, and about social distancing and the 6 feet away and washing your hands, and trying to get people their food items and make sure that that they have a hot meal. And that's all. Thank you.
Thank you, Pat. I appreciate it. Is there any other public comment at this time? If there is, you unmute your mic by pressing *6. And remember, when you're done, to hit *6 again to mute it. Any other public comment?
Commissioner Tipton? This
Yes.
is Commissioner French. I had one comment to make to Patricia having to do with the masks. I'm not sure if she has had an opportunity to touch bases with the Mucka mask makers, but there's about 175. I'm not sure how many are actually doing it now, but I know they've prepared over 3,000 masks that they have built and are distributing throughout the community. So if she got a hold of Leanne Robertson, who's kind of heading that up, they would put her on the list for a number that she's looking at to fill an order for her. But they are actually, there's about over 100 women right now in the community that are making them. So at any rate, I just wanted to pass that along to her. Thanks.
Thank you, Commissioner French. Any other public comments? No public comment? Okay, we'll move on to item 4 on our agenda. It's an update from the Public Health Officer, Dr. Stringham, and we'll let you go with the
Excellent.
update,
Good
Dr.
morning,
Stringham.
everybody.
Go ahead.
Can everybody hear me?
Yes.
Sound quality good. Okay, excellent. Thanks.
Yes.
Well, I'd like to start my comments this morning by letting you know that I think we're coming to a very critical point in our campaign. And there are going to be a couple of major changes that start happening over the next several weeks. And I think we need to prepare for them and do a lot of the right things still. I'd like to remind everybody that the inherent simplicity of our plan and the message that we give is not about to change. There's really nothing in this next juncture that will require that we do anything differently from the way that we're already doing things now. You've heard me say before that we have the power to stop this virus, and that's true. And it's also true that it's never going to be more critical that we do the right things than it is during these next phases of our campaign against the virus. So we had our first case 37 days ago. And so far, we've had 40 cases. And so the progression rate is more or less linear. We're adding about 1 case on average every day. There are some lulls and some fast times, but in general, the virus is being added at the rate of about 1 new case per day. I'd like to explain also that there are themes in these next several steps that we take. And the primary theme is that we're about to move from having social distancing provided primarily by being at home to having social distancing primarily provided by actually doing the social distancing. And so those people who have not yet engaged in doing the right things during this next phase of our campaign are going to become more dangerous than they are now. And that really concerns me because we still have quite a number of people who have not engaged. We're working on ways to help those folks. I'd also like to explain that it's almost like a seesaw where one side is going to go up and the other side is going to go down. What's going to happen is the first stages of this process, which primarily have been learning new behaviors, applying those new behaviors, kind of having a learning curve, those are about to transition to something that's a little bit different. And we're already starting to see some of that now. So in addition to the business reopenings that we'll talk about this morning, and I'll talk about a little bit later, we're also dealing with an insidious enemy, and that is burnout, and also one other thing that I'd like to talk about in a couple of minutes. So as we transition from primarily a public education program, we'll be transitioning into doing some other things that will address some of the issues that we'll likely encounter during this next phase. I'd like to urge everybody during this process that it's important for all of us to resist the burnout that many of us are feeling by staying at home and having our businesses closed and having the other hardships that each of us are going through. We need to resist that burnout. And we also need to resist one other thing that we're starting to notice, and that is that there's starting to be a resentment among the people who are engaging, who are doing the right things, who are part of our solution. And they're starting to resent those people who are not engaged. And I would request that each one of us takes that resentment and instead channels it into something constructive, like reaching out to those folks and helping them to engage and do the things that the rest of us are already doing. Do the right things and take that leadership role. Next, I'd like to talk a little bit about our current statistics. So 37 days in and 40 total cases. So more or less 1 case is being added for each day. And that really hasn't changed. Our growth curve has more or less been linear. It has not changed. We've had some days where it hasn't been quite as much, and other days it's been a bit more. But in general, it's been about 1 case per day. So far, we've had a total of 11 admissions. We've had 9 intubations. We have 2 currently in ICU in Reno. One apparently is doing much better, and the other one, as of this morning, we weren't sure whether that patient was still intubated or not. We were trying to get some information about what was going on. I'd like to put this into context for you. And essentially what this means is that 1/4 of our citizens who develop this illness in Humboldt County go on a ventilator. That is astronomical in terms of the dangerousness. It is more dangerous for whatever reason, and I don't know why. We're looking into specifics, mechanisms, things of that nature. I don't know why, but we have 25% of people who go on mechanical ventilation in our community. And it's very concerning. I'd like to emphasize that the lesson in these data is that primary prevention, that is making sure that we do not pass this on to anybody, is the primary strategy in fighting this virus here in our community. And next, I'd like to weave 2 different topics essentially into each other because they're very closely related. And one is business reopenings and the strategy there, and the other is our FAST team. I'm very excited about both of these. So let's start a little bit with business reopenings. And I'd like to talk a little bit about various things that are going on. Oh, it sounds like somebody may have a Everybody check
Yeah.
your mutes. I'm hearing somebody speaking. It sounds like somebody's having a conversation.
Excuse me, Dr. Stringham. Anyone out there that's on the meeting right now, please mute your mic. Thank you.
Excellent. Thanks so much. So first, let's talk about something that I know is on everybody's mind, and it really is part of the nidus that we have for a lot of the burnout that we're feeling in the community right now, and that is our business reopenings. I'd like to start by saying that most of us who serve in leadership roles in the community do have either our own businesses or have been involved in business in some way during our careers. Business reopenings are very near and dear to the hearts of each of the people who are in decision-making capacities in this community. And I'd like to assure the citizens of Humboldt County that each of us feels, quite literally, the pain that each of you feel. And I want everybody to know that. I'd also like to explain that it's critical that each of the constituents in our community see the leaders as being referees. We're not the ones who are directing this process. We are decision makers, but we all hope that everybody will do the right things. And if we see those things happening and start to see our infectivity curve drop, then we will have the capacity to say that it's now safe to do the things that we all want to do to reopen our businesses. Ultimately, we're not the ones who are controlling this. We're the ones who are interpreting what's happening, but each of you in the community are the ones who are controlling this. So I'd like to start by saying a couple of different things about general principles in terms of opening businesses. And so the first is that stay at home and business closures were definitely the safest thing to do initially. But the problem is they're not sustainable, they're not desirable, they're not fun. And most of us are really starting to feel this as being a hardship. But they definitely create a bright line between what we should do and what we shouldn't do, because you're not available to infect other people if you're at home and don't have access to anybody else, except those people at your house, of course. But when we start moving forward into businesses, when businesses open, when patrons start pouring into those businesses, we're going to experience a new threat. And that's why it's so important that each of us continue to do all of the right things, the social distancing, the hand washing, the glove wearing, if you choose to do that, hand washing in any case, and the various other things, masks and the other things that we're doing, also reaching out to other people who are not engaging. So it's important that we all do the right things, because it's going to be the mainstay of our ability to keep our businesses open as we progress from one phase into the other, from one type of business opening to other types, and that process can happen much more quickly if we all do the right things. So I know that we'll be talking about this from a business perspective, but I wanted to give you the medical perspective during my part of the presentation this morning. Again, the central theme here is whether we are able to succeed in this process and how quickly we are able to succeed all really comes down to what the constituents do, what each one of you in the community chooses to do. And if everybody chooses to do the right things, if everybody engages those people who are not doing the right things, then we can progress through this phase very, very quickly. The FAST team is well underway at this point. I'm very, very proud of the things that we're accomplishing, and I want to kind of bring you up to date on what's going on with that. And so we have about 6 different team members. There are 2 primary team members, and then others are playing supportive roles for those 2 primary team members. And we are reaching out to members of the community who have been people of interest. They're called PUI, and that is person under investigation, but they are cases where a person is suspected of having the virus, but not yet proven to have the virus. We have positive cases, and then we have contacts, and our FAST team members are reaching out to those folks, and they're doing so daily. We started operations on Monday, and we're in the process of having a transition between the state primarily doing this and our volunteers here in Humboldt County primarily doing this. So the state is in the process of stepping back. They will do that completely once our people are trained, and there's a training program that the state offers that we'll all be going through to make sure that people are up to date on some of the latest techniques and doing things the way that the state would like us to do them. I'd like to point out that the state epidemiologist's office has done a fantastic job. They've been extremely responsive, and I really enjoy working with them. We're not doing this because the state is not doing a good job. I can assure you that they are. But we're doing this primarily because the state is overwhelmed with well over 4,000 cases, and we are trying to lessen the burden on them. And also, we feel that there are certain issues here in Humboldt County that are unique to Humboldt County that may not be understood by people who don't live here. Number one, a lot of our contacts involve people who most of us know, and they trust us, and we have a rapport with them. We think that they're more likely to be honest with us, forthcoming. Also, the mines, while the mines are doing a fantastic job in the control of this virus, and we've had remarkably few cases in that particular community, there also is a specific way of reporting and of working with mine safety folks, human resources, and we like to make sure that the people who are doing that have consistency and that we have the same people we're communicating with. So I think there are a number of other reasons as well, but these are some of the reasons we decided to start this team. The other reason, the third reason, is because the findings of the FAST team dovetailed back into our business reopening programs. And that's one of the reasons why we are very proud of the accomplishments, and we should be seeing over the next couple of weeks some of the data that will help us to open some of these businesses more seamlessly. So next, I'd like to talk about our public awareness campaign. And there's a primary thing that several of us have been concerned about. I wanted to introduce this and come up with a way to address it. And that is Cinco de Mayo is going to be happening fairly quickly. Many of us really enjoy Cinco de Mayo. I've certainly gone out and had a very nice time during most years myself. And but this year, I'm not planning on doing that. And I would encourage everybody in the community to celebrate safely, which to me means celebrate Cinco de Mayo at your homes. Celebrate Cinco de Mayo at your homes specifically with good social distancing and mask wearing. Please don't invite guests over to your house, and understand that celebration of Cinco de Mayo really is a celebration of people and various freedoms. And it's not a good way to celebrate something like that to get people infected. So do the right things, particularly during the Cinco de Mayo celebration. Celebrate safely, celebrate at your house. Do not invite other people over. Those are my recommendations. I'll be making an appearance at the Hecla Mine very soon as part of our public awareness campaign. I'd also like to point out that I've given several other public appearances at various workplaces, and I'm available to do that. From my perspective, for the community's perspective, even though these are relatively small audiences, they're still a great way to get the message out into the public. And I see many of the people we've talked to as also being community leaders. These are great ways to get a message out to a large group of people by planting the seeds there at places of employment. The mask program, I can't even say this without a smile, and that is that 2,000 masks had been made last week, and at this point we're well over 3,100 masks by the Mucka mask makers. 1,100 masks made in only 1 week, and let me put that into perspective. What that means is that during only 25% of the time this organization has been in existence, they've made 1,000 new masks in 7 days. It's kind of amazing. It's a wonderful story. They're continuing to distribute these at points of sale at stores, and they're available. They're doing a wonderful job. I'm very pleased. I want to talk about testing and capacities. We have been allocated 500 rapid tests for Humboldt County, and Captain Wilkin of the Sheriff's Office will probably talk about that in a little while. We're having some difficulties actually getting those tests, and so far we've gotten just a little bit less than 196 tests. And I'd like to emphasize that this is a game changer. Even though we only have 100 tests, there was a time not very long ago that we didn't even have 8. And I'm just very appreciative of the work that is being done by the various agencies to bring these tests to us. We have 1,000 non-rapid tests available to us. And that's also very good news, because during much of this, we've had less than 20% of that. So this is wonderful. The tests are coming back reasonably quickly, and we're now much less limited in terms of the number of tests that we can do, more limited in terms of the number of rapid tests to which we have access. And next, I'd like to talk a little bit, Commissioner French, you had asked during our last meeting, I wanted to incorporate some of this into my presentation this morning, and then I'll wrap things up. And I did have a very nice conversation with Dr. Farr at Humboldt General Hospital, and he is our chief of the emergency department. And we talked a little bit about what people can expect when they come to our hospital, as opposed to what they can expect going to others. I know that there were some concerns that had been expressed that there might be people from our community who would opt to go to another hospital for perception that they may do more at those other hospitals. What I can assure everybody is that that's not the case. Humboldt General Hospital is doing absolutely everything that's done at any other hospital, including large tertiary hospitals. And I think that they're doing a wonderful job. And I'm very convinced that there's nothing that would be done at any other hospital that would not be done routinely at Humboldt General Hospital. They certainly have access to any, I shudder to say treatments, because remember from last visit, we had indicated that there really aren't any proven strategies. A lot of these are anecdotal, but all of those anecdotal therapies are indeed available at Humboldt General Hospital. So Dr. Farr and I talked a little bit about the use of antibiotics. And of course, with a virus, antibiotics are not particularly effective. In fact, they have no effectiveness at all. But in some cases, there will be what's called a secondary pneumonia or secondary bacterial pneumonia, community-acquired pneumonias. And in other cases, what we think initially may be COVID-19 is in fact another type of an illness. So giving antibiotics in those cases is a good way to cover ourselves and to make sure that those patients are treated in the event that there's a diagnosis that evolves and we learn new things over the several days that they may be hospitalized. We have access to antiviral medications, and those are not routinely used, but they're quite safe, and the efficacy, the way that these medicines work also is not yet completely proven, although it's suspected that it does have some activity. And we also have access to other medications, Remicade and plasma treatments that can be done also. So I'm very confident based on the conversation that I was able to have with Dr. Farr, and I appreciate his assistance very much, that we're doing all the things that we can do that are proven to work and that would be done at any other center. I'd like to wrap up my comments by giving you a very simple message, and that is everything that we need everybody to do is simple and it's easy. It's just a matter of being able to do these things. These things don't cost money. These things don't take time. They don't really induce that much of an inconvenience in our lives, but they make such a major difference. So I call on everybody in Humboldt County to do the right things, to wash your hands, to social distance, to wear a mask, to reach out to others who are not yet engaged and be part of the solution. Thank you.
Thank you, Dr. Stringham. I just may add in a comment right there that when you're engaging someone that is not wearing a mask and you want to strike up a conversation about that, one thing that you might add is just because they're not afraid of getting the virus or what it may do to them, they need to understand that they could be passing that on to others, and especially to their loved ones.
It's very true. And I think that one of the things that has been the hardest to convey to people is that we need to change what we see as being a threat. We look at people who are coughing as being a threat. We look at around a room and try to figure out who may give us this virus. But those are remarkably bad strategies. The better strategy is what in medicine is called universal precautions. And that is every single person around you is assumed to have this virus. And the behavior becomes staying away from all other people, exactly as you said.
Thank you, Dr. Stringham. We'll move now to Captain Wilkin, our local emergency manager. Captain, are you there?
I am. We were trying to get things squared away with IT. Sorry for the delay. So to build on what Dr. Stringham talked about with the test kits and the allocated numbers. So we still have the 500 test kits that are going to be allocated to Humboldt County. The 96 is the first in a series of delivery of these test kits that we're going to get. And to try to inform people about how these test kits work and the production numbers, Abbott, which is a company that makes these test kits, it also makes the machines to go to the test kits, currently is producing 1 million tests per month, and that's what's distributed throughout the United States. Nevada and the state lab are the ones who are making a request through Abbott and FEMA to obtain these kits for the state of Nevada. To reach out for our county, we have talked to Nevada Department of Emergency Management. We've talked to our FEMA congressional representative in Washington, D.C. We've talked to representatives from Congressman Amade's office, from Senator Cortez Masto's office. Those were facilitated by the county commission, and I do want to thank the county commission for facilitating those things for us. We are working as hard as we can to get the full allocation of the test kits. They are going to continue coming into the county, and they really are a great tool for us. And I know I've talked about them a little bit in previous health meetings. We have them, they're here, they're usable. We're going to continue to receive the allocations of them until those 500 tests are met. And we're also looking at some community-based testing in partnership with Nevada Public Health. And that just started this week with the conversations about it. And that's something that we're looking at going forward with as well, so we can have more widespread testing and a greater sampling of our community to find out how big a virus this has actually had, or excuse me, how big of an impact the virus has actually had in our community. So there's a lot of logistics that go into these things moving forward. It is a kind of long process to get all these things put together, but it's something that we actively work on every day. I've told people this before, and I do want to reiterate, we actively work on these things every day. For the emergency management side, this consumes the bulk of my work days, and right now it's 7 days a week, and we're doing absolutely everything we can to try to bring resources into Humboldt County to keep everybody here safe. Working with the other entities, Department of Emergency Management, we're still working with them. We have our daily meetings. We're disseminating information out to our local and non-government partners as fast as we can with these things to try to make sure that we're doing things like getting the small business information out to people, engaging that part of the community, because we know that this has had a very negative fiscal impact on people in our community, and we do understand the frustrations. Also, to Dr. Stringham's point earlier, I know he said people are starting to kind of get to that frustrated point with the quarantine and businesses being shut down or reduction in services. The ultimate hope is to get people restored back to where they are or were prior to this virus having an impact on our community. And through emergency management and the things through the Small Business Administration, these other programs coming out of the state, I urge people, if you need help with them or if you need information, call me. People are always welcome to reach me here at the Sheriff's Office. It's a 623-6419 number. We can communicate through conversations or emails, and I'm happy to try to get this information back out to our community to at least get people pointed in the right directions, to find the resources they need to keep your businesses, keep your life and things back to where that they're supposed to be prior to this impact. Emergency management, we're having constant conversations throughout the state on how to get things restored, how to take care of our communities while we do that, and really get people back to the quality and level of life that they expect, and also keep people safe. And keeping people safe is the biggest part of this. Bless somebody. So that really is our goal here with working with these things. The test kits, it is an ongoing venture on our part to make sure these keep coming into the county, the state, and I will tell you, anybody who will listen to us is very well aware of our need in the county for these test kits. And I have talked to pretty much anybody who will listen to me from the state to the federal level to express our need for them, to express our issue with per capita cases in this county, and really do the best that we can to get these into Humboldt County. And it is still an ongoing and active process. We're not sitting back just because we got the first batch of those, and we're going to keep doing the same thing that we've been doing. And as far as that goes, if people have questions about any of this, please reach out to me. I'm more than happy to talk to anybody. If I don't know that the questions are there, I don't have the ability to get the information back out to people. We're trying to be as transparent as we can about these processes and make sure that people know what's going on here, both from the county and government management side as well as the public, because I think that the public has a very vested interest in what we're doing to keep them safe, and we want to be the best partner that we can back to our community.
Thank you, Captain. I have a question. I don't know if it's for you or for Dr. Stringham, but what about the antibody testing? How far out are we on antibody testing, and will that be available soon here?
Go ahead, Doc.
You're on mute.
I can't hear you because you're on mute.
You're correct. Sean, maybe go ahead and answer, and then I can give my component to the answer too.
Okay, so my understanding of the antibody testing is, when I was speaking about community-based testing, my understanding is that is the antibody testing. I know that there is antibody testing that is available through private clinicians or physicians right now. As far as the widespread antibody testing, my understanding is, and if I'm wrong, I'll correct myself on this later, that the community-based testing is the antibody-based testing.
So my understanding is that the community-based testing will be antigen testing. The nasal swab is what I think. I can get back to you on that. That was kind of what my understanding was. And the reason was we were interested to know what percentage of people actually have this virus now. Antibody testing will absolutely play a role in this, but I could absolutely be mistaken. But one of the things that I'd like to point out about the antibody testing is that the current antibody testing, there are no FDA-approved antibody tests as yet. And we're having major problems with the antibody tests at this point. The false positive and false negative rates of the antibody testing is so high that it really almost has no clinical relevance whatsoever. It may have some utility testing populations, but the very first thing most of us are doing when we do antibody testing, whether it's positive or negative, is repeated, and it has very limited clinical relativity at this point. At some point, probably over the next couple of weeks, we'll gain access to better tests. We'll be able to do that a little bit better.
So the antigen-based or nasal swab testing, that is a rapid test as well?
It can be. So there are two different types. There's the non-rapid, kind of the conventional test that takes between 1 and 5 days to come back, and then the rapid tests, the ones by Abbott, are the ones that Captain Wilkin was able to get so many of for us, and that's a rapid test.
Okay, thank you. We'll move to Nicole Maher. Do you have anything that you would like to add? Are you with us, Nicole?
I am. Good morning.
Good morning.
I'll just bring us up to date on our efforts this past week. I am just impressed with this great team that we've brought together and excited for how we're moving forward. Last Thursday, a week ago, we had a meeting with all of the response organizations. So this would be the county, the city, the Sheriff's Department, Emergency Management, PD, NHP, and school district wasn't there, but we definitely include them. And then, of course, Humboldt General Hospital and HGH EMS Rescue. And we had a really good discussion about how to present a more unified response as far as information going out into the community. And we are going to and have already started to undergird those efforts under a campaign called All for One. And the idea is that all of these efforts, and as you can hear from the comments so far, and there will be many more in this meeting, there are so many efforts going forward in so many different ways. But all of those efforts are worth it if we can save just one person in our community, if we can save one family from the grief of this virus. And so this will just be a fun campaign and an important one to bring us all together. And so what we're doing is I'm kind of leading that effort in sharing what Dr. Stringham's priorities are, what our priorities are for the day and for the week, and then inviting each organization to share that information in their own unique way and in the way that best benefits their individual publics. We've also, Dave Mendiola is just a fantastic person to work with, and he just has lots of ideas. He's a great idea person, and he and I have talked about just giving people more information in any way that we can. People are just seeking information. It's interesting, in normal times, you can do just so much over social media or so much in communication platforms, but in a crisis time, you can multiply that almost exponentially, and so people are seeking and wanting to know. And so, of course, we share number of confirmed cases and things like that, but we talked about also sharing number of active cases. So that would be the number of our confirmed cases minus recovered cases, minus deaths, and that would help people understand how many are active. Just to give you some idea, with the efforts that are going on here and some changes at the state, we are trying to get recovered cases, right? So far, we've been told we have 5. We know there are more, and the state has indicated that there are more, but they go through quite a process to exit people. And so we'll be seeing more of those numbers. And of course, our great FAST team will be helpful in that. We're trying to share a number of overall tests. The hospital is wonderful about sharing that information every day. Number of tests pending, number of people recovered. And I just want to give a really great shout out to our city manager, Alicia Heiser, who has stepped up. She is just a numbers guru, and she has been taking our data and she's working on some graphs and just some wonderful visual representations of what this data looks like, and those are going to start going out here very quickly. We've had a few running cases this week, and so every time she gets those graphs ready, we get another case, and then she has to redo the graphs. And so I'm hoping we can get to a lull here quick and get into a pattern. Also, from a suggestion from a community member, looking at some comparative data across the north. And so my son, Dane, who is wonderful with maps and things like that, he's been working on putting together a map that we'll be able to share and kind of track those numbers as well. Yesterday, our wonderful unified group came together and created a video archive with the help of Jim Billingsley at Jim Dandy, and we were just very appreciative of his help and efforts. And so we'll have about, I don't quite know where we ended off because we were kind of throwing in videos here and there, but at least probably 10 videos, again, from the mayor and from our great Ken Tipton even got on there, did a great job, Ken, and everybody just did a great job. And we got some final videos from Dr. Stringham, and we were just very appreciative of that. So we will load those on a YouTube site, and people will be able to have access to those. And then, of course, we'll share them across channels as well. There's been some mention of the Mucka mask makers, and I've just been trying to keep a little bit more in touch with them and see what their needs are. And so just want to undergird their efforts. And they have some needs right now as far as elastic and bias tape and plastic baggies and things like that. And so we're sharing that information out among our channels and how to get those supplies to them. Our all-county postcard is going out. That will go to every household in Humboldt County, and excited about that and just that basic information that we can share for those who are on the electronic medias. It won't be new information necessarily, but it will be all the information in one place, as far as sites and numbers and email addresses, and then just reminders about what our priorities are as a community as we try to reopen. Senior and county bulletins going out, and that's been a good process. And also been in contact with the Fort McDermott Reservation. Those folks have been fantastic about offering their help to get information out to that community as well. And so that's something I'll be working on this week. As far as our Facebooks, the county and the Dr. Stringham Stop Coronavirus Now, and also our Spanish one, we're seeing increased presence on all of those, and just appreciate people sharing, passing along that information. It's maybe one concern that I've had is just some people in their zeal to share have maybe shared a little bit of medical information or things that has been concerning or maybe just a bit off. And so just looking at ways to solidify that Dr. Stringham is our medical authority on COVID-19 in this community. And we love that people share that information, but just maybe want it to stop there. And of course, share their opinions and things like that, but we don't want other people presenting themselves as medical authorities. We have gotten some really good coverage, and kudos to Dr. Stringham, who is just so busy right now. I'm sure he's going to look back on this time and just shake his head at the things he's been able to get done. But he has been so gracious about my requests for him to participate in different kinds of interviews and things that we think will be beneficial to Humboldt County. He's done interviews with KUNR, which is an NPR affiliate with University of Nevada, Reno. We've done things with Elko Free Press, with Nevada Independent, of course, with El Sol, our Spanish newspaper, and so much with Nomadic Broadcasting and KWNA and with Humboldt Sun. And we just especially want to share our appreciation for the Humboldt Sun and for that group, and for Jace at Nomadic Broadcasting and Stephen at KWNA. They really have been champions in this effort, and appreciate them so much. Still looking at working with school districts on getting inserts to them. I'd like to make that a weekly thing, and those school lunches going out, 1,600 of those going out. That's just a wonderful population that we can get to. And then just trying to undergird all of these wonderful efforts going forth with the business reopening. Nikki Lynn, what a fabulous job she's helping with that, the FAST team, and Ken Whitaker and his efforts leading out with that with Dr. Stringham. And Dr. Stringham's going to talk about a challenge that he's going to share with the community today. And so we'll definitely want to share information about that, about the mask wearing and the social distancing, and just keeping that in the forefront of people's minds. Like Dr. Stringham said, we're noticing maybe everything from complacency now, just people are tiring of this, to, as he said, even resentment, and just people wanting to get back to their normal lives. We all do, but that's the key. It's just the simplicity of that. And then, of course, want to help promote our wonderful mental health resources that are going forward. Humboldt Connection Suicide Prevention Task Force is on the lookout for those issues and opportunities in our community, and they're working on Hope PAGs, and just very proud of those efforts, and looking to establish an assist line where people can call a local number, and so we'll be helping with those efforts as well. Our Spanish outreach continues. Special thanks to Abel at the county and dear Griselda Soto for helping so much with that, and Mike Rangel with the city. I think we're making some good strides there, and our Spanish Facebook is increasing in its reach every single day. And then just in general, information is kind of like medical kinds of things. We want to work on preventative things as opposed to waiting for problems to surface. And so that's my job. My primary job is just to be on the lookout for preventative ways to share information before things really blow up or get to be an issue. And so I'm just trying to manage our current information, but look for gaps and then try to respond appropriately. So that's my report for this week. I'm happy to answer any questions that you have.
Yes, Nicole, I have one. We talked about getting the data. What about, do we have any information
You've got
on the
feedback.
average number of people that the FAST team has to contact with each positive that we receive? Is it, I mean, I know that can be someone that doesn't get out socially much and against someone that does a lot of social contacts, but do we have an average number of people that have to be contacted?
Oh, Ken, are you asking me?
Anybody.
That's sorry about that. So, the number, as you've pointed out, does vary quite a bit. And so essentially there have been cases where we've contacted as few as 3 or 4 people. And in those cases, we suspect that maybe people are being a little bit less than honest. And we have recently had a case involving one person who infected another, and then that second person went on to have contact with perhaps up to 40 or 50 different people. Most of those people will not be close enough, will not have been close enough to have actually been exposed the way that we would define it. So we have a criteria that we use and look at the numbers. But I would say that the direct answer to your question is between 3 and maybe 30 or 40 people on average. My supposition would be about 5 to 10 is what I would think. I'm going to ask the FAST team now and have them get back to me so that I can answer your question later during this broadcast.
All right, thank you. Are there any other questions of Nicole, or for that matter, Captain Wilkin or Dr. Stringham? No, well then let's move on to item 6. What happens once a person tests positive? Dr. Stringham, I'll let you answer that. Maybe Ken Whitaker would want to join in too, but we'll start off with you, Dr. Stringham.
Okay. After a person is essentially, there are a few different ways that a person can come to attention to our team. They can come in a conventional sense, which generally comes directly through the hospital. And so the hospital is the only source of testing in Humboldt County, although some people do come into our system from outside sources. Just yesterday, we had a person who came in from Idaho. The person was tested in Idaho. We've also had a gentleman tested in Elko. So people can come to our attention from outside municipalities, and we become aware either of a positive case, or we become aware of a person who is a person of interest. They've been tested, but they're not yet known to be positive. And in those cases, the FAST team becomes aware of that very quickly, directly through the hospital. So the FAST team and I learn about that simultaneously, and from there, they start contacting the individual cases. Now, at this point, I'd like to point out that the state is still doing that. And so the transition between the state and the FAST team is not yet complete. And as soon as the training is complete, then the state will stand back and no longer do the contact tracing. So right now, the state and our FAST team are both simultaneously doing the same types of things. In the future, our FAST team will be the only team that's doing this. So we contact the people and we talk a little bit about the nature of their contact. And this is really kind of speaks to the spirit of the question. That is, we want to know what the specifics were. How close was this person? How long a period of time were they that close? And generally, we divide things down. The CDC Centers for Disease Control and Prevention, their criteria are a little bit different from ours. Ours are more conservative, and we interpret what we consider to be a true contact, likely to have resulted in an exposure, to be more conservative than they do. And the reason is they are looking at things for an average community. And my concern is that Humboldt General Hospital is a wonderful institution, very, very capable. I'm very pleased with the hospital and their response. My concern is that it's a small hospital in a small community. And if we were to have several hundred cases, it would be a mass casualty type situation. Whereas in Reno, they would be able to have that number of cases and still operate within their capacities. So our primary strategy has been prevention. And that's one of the reasons that our interpretation of what constitutes a contact is more conservative than it would be in other communities. So what we do is we set 3 different parameters for distance. One is an actual physical contact. So a person makes contact with somebody else and has any sort of a touching episode. No matter how long that lasts, we consider that to be a contact. The next is anybody who's within 6 feet but does not actually have physical contact. The next is 6 to 10 feet, and the non-contact category would be category 4 is greater than 10 feet. And we consider that if it's greater than 10 feet, we really don't worry about those contacts at all. We think that the probability of infection is low, and low enough that we really don't need to consider that to be a contact. Centers for Disease Control uses 6 feet. We use 10. And then we also have time parameters, and we determine whether a person was wearing a mask or not wearing a mask. And if a person was wearing a mask, we'll allow that contact to have occurred a little bit longer until we consider that to be something that's likely to have resulted in infection. So those are the things that happen. From there, the team maintains contact with those people who are ordered into respiratory isolation, as they would be if we define them as having had a true contact and likely to have resulted in exposure. And then our team continues to make contact with those folks. Griselda Soto has been the primary person doing that. We're expanding now. And we make contact with people daily and make sure that they're complying. So those are the things that happen when a person is intervened upon by members of our FAST team.
Thank you. Ken Whitaker, do you have anything to add to that?
Mr. Chair, I don't know that Ken is on the line. If he is, please *6 Ken, and or anybody else who has a question, *6 to unmute yourself.
No other questions? Thank you, Dr. Stringham. We'll move to item 7. That's experiences of the coronavirus victim. Presentation by the doctor on the range of symptoms that have been experienced by individuals that have tested positive for the virus in Humboldt County. Go ahead, doctor.
Well, in terms of various symptoms, I'd like to point out in generalities that most of us, if we walk around on the street and ask people what the symptoms of coronavirus are, you're going to hear a lot about coughing and a lot about shortness of breath, chest pains, and fevers. I think that's kind of what the public looks at as being the symptoms. And I'd like to point out that the first thing is when you look at the probabilities of any of those individual symptoms, they're mid-grade at best, which means that a lot of people really don't have much of a cough. That's approximately 25% of people. And a lot of people do not develop fevers. A lot of people do not develop that shortness of breath or chest pain. In fact, those are even less likely to occur. And the symptoms that tend to fool us, meaning the symptoms that people have that they don't recognize as being COVID-19 symptoms, those are things like sinus pressures. We're seeing a lot of that. And we're also seeing quite a lot of gastrointestinal symptoms. And that's one of the reasons that we can differentiate this from influenza. Influenza does not tend to cause gastrointestinal symptoms, at least get lower gastrointestinal symptoms, diarrhea, cramping, things like that, as frequently as COVID does. So when we see gastrointestinal symptoms, that's that's concerning these days. When we see sinus pressures, especially this time of year, because a lot of folks who have allergies, seasonal allergies to begin with, this is about the time that those seasonal allergies are starting to ramp up. And so as a result, a lot of people, when they come to the office, will let me know that my allergies are back, and they say that with confidence. And then once I start asking them a few more questions, it becomes clear that these are not seasonal allergies. And so the message, kind of the message to our audience, to the constituency in Humboldt County, is please be aware of any symptoms that you didn't have previously that could be infectious, particularly gastrointestinal symptoms, achiness, and sinus pressures, because those are very frequently misinterpreted. Very few people are going to misinterpret the symptoms that are common. And so I have every confidence that most people would know to look for coughing, shortness of breath, chest pain, and fevers, but is definitely become aware of those other symptoms that are perhaps less classically thought of, but are quite classic of COVID-19. And I would also caution everybody to make sure that to communicate with medical staff effectively. A lot of people like to come in already having given themselves a diagnosis. And what I would caution people to do is come in and let us know what the symptoms are and allow us to add value to the interaction by having us be the ones to give the diagnosis.
Thank you. Any questions? If you have a question, you'll need to unmute your mic, *6. Hearing no
Commissioner
que-
Tipton, I have other information for you. So
Yes.
let's see. The Whitakers have just gotten back to me, and the average number of contacts per for tracings, people who have become in contact with a positive case, that average number so far has been 4.
That's good to hear. So that tells us that people are practicing staying at home and social distancing, really. Okay, let's move to item 8, discussion regarding safely opening of the economy. And I think we're all hoping that we could get businesses open sooner rather than later. It would be nice if we would quit having active cases here in Humboldt County. But I'll let you talk more on this, Dr. Stringham. A lot of us have ideas on it, but yours are coming from a medical background. I think they're more important. Thank you.
Thank you. I think that the general themes really are that once we start to see this curve change its trajectory, I think that we can look at the time. I think we all are on the same page in terms of what we want the end result to look like. And I think really it's a matter of timing at this point and when that process can start happening. And I think the most important thing from a medical perspective for us to see is we need to be able to see that curve start to change, start to not go up at such a high rate. So far, we've added approximately 1 new case every day. So we're at day 37. Today's day 37 since since the virus first came to town, was formally diagnosed initially. And so 40 cases in 37 days, it's more or less 1 case per day. And I think once we can start to see that to drop, I think we'll be in a position to start opening businesses. And I know there's also a lot of ambiguity, not from a medical perspective, but a lot of ambiguity at the state level. I know that we're looking forward to seeing what the governor's presentation will look like today, and some of the guidance leadership that's going to be done. I also know that there are there's at least one other county that's considering just opening against recommendations, and I wouldn't recommend that. But I think that once we start to see this curve flatten a bit, I think that we can certainly do that. And I think that I'd like to reemphasize what I said previously, and that is that each of us on this board, and certainly each of us in leadership positions in the community, really are we're observers, we're interpreters, we're people who determine what it is that we're seeing in the disease curve and in the performance of the community in terms of engagements and social distancing. And we interpret what we see, and we can open businesses once we start to see that happen. My hope would be that that happens very, very quickly. If we can start to see a flattening here, even over the next several days, and we can get good guidance, non-ambiguous guidance at a state level, then I think we could potentially start doing something within the next 7 to 10 days.
I think too that the community-based testing that Captain Wilkin talked about, it could be a really an important part of this, so that businesses that are contemplating reopening, when that time comes, that they'll be able to have their employees tested so they know going in that they're clean to start with. I think those are some really important aspects of this.
I think that's true. And during the last 24 hours, there's been a little bit more guidance from the state level. Initially, we had known that this community-based testing was going to happen. A lot of us were trying to figure out what it was going to look like. And I know that Marcia, the community health nurse, and Dave Mendiola had both recently sent some information to me about what this may look like. And that's just been here over the last 24 hours. So I'd also like to point out that that we're all focusing on the dangerousness, on the dangers of opening businesses. I think there's one major advantage to opening businesses in a limited fashion, and that is now people will be in public, but they'll also be in public in a much more controlled environment with proprietors who've shown that they're responsible and that they're licensed and that they follow procedures, and people can be monitored much more closely to make sure that they're doing the right things. If a person's in a business and the proprietor is making sure that everybody's doing things the right way, then there's a lot more control there and oversight than there would be to see people standing on a sidewalk and accumulating without anybody to let them know that they need to follow safety procedures. So in some ways, opening the businesses may actually produce a safer situation than what we have now.
Thank you. Mr. Mendiola, I know you've been working on a template for this. Do you have anything you'd like to add?
Thank you, Mr. Chair. Dave Mendiola. Yes, so we have been monitoring a lot of data that, as you know, all of us are experiencing coming through email and various sources and various agencies, both state and federal and local. And so what I've really tried to do is capture the essence of those, because there's almost too much data in many cases just to get your arms around. But so what we did is we came up with an idea that we could engage all of our non-essential businesses. Of course, our essential businesses have been doing this, and we've seen, you know, examples of that all over the city and throughout the county. But so what we've done is we've put together a form which lists what are you as a business owner going to do, and we've listed anywhere from 12 to 15 different examples of mitigation protocols that they could deploy in an opening. And then there's a second section which deals with, okay, now you're open. What are you going to do on this while you're open that can change as we grow the size of those crowds? Let's take a restaurant, for example. You know, maybe you start with a smaller footprint. You're going to invite in maybe 50% of your normal capacity. After you're going a week or so and you find it's working, and we've had, which I'm going to talk about in a minute, we've had no reports of any new incidents or positive tests that have come from a public sector. Then they start to, you know, to get a little bit larger. Is there anything more that they can do? Again, we list about 12 to 15 ideas that they can look at to implement within their organization. And then the third section is long-term. What are you going to do long-term as we try to get back to some sense of normalcy? So the plan for this this form is through the Chamber of Commerce. Debbie Stone has been gracious enough to offer their services for mailing lists, maybe some postage and things like that, to get that out to these owners and get it out to them quickly. The ask of the owner and or the manager of these different businesses is to fill the information out. And we've also left space there for details. So we'd like to know more, because, you know, you may have 2 restaurants, but their actual brick and mortar, their space is very different. So what we're really asking for them to do is to be very specific on what they're going to do in the space that they have provided to maximize our safety issues, our distancing, and all those types of things. And so the idea in the end would be to collect all these. And what I will do, my office will do, is we'll compile them, and then we're going to present them. It's my understanding in a discussion with Dagny Stapleton from NACO, Nevada NACO, that the governor is assigning a task force of some local folk, well, not local folks, Dagny herself, some county commissioners around the state, and some other key individuals that are going to be a task force that are going to look at some of these ways that they can help people open quicker. So I'm going to gather all that information. I will get it to them along with this form, and then the next piece, which we kind of need to talk about, and if you don't mind, I'll just transition into that. And it's one thing to open our businesses and open our economy, but the other safeguards that we need to put in place, which the governor's already made comments about, is what are we going to do to make sure that the safeguards we've put in place and the opening is being successful. And part of that is testing, which we've talked about. There'll have to be some sort of community testing. There is some information from a document that I scanned yesterday that was very good in terms of giving us an outline, saying that, you know, our number one priority, which by the way we've been doing for some time, is our medical staff workers and anybody who's infected by the virus. So we've talked a lot about that, what we're doing with those people. The second part of it is we've already got in place, that's the FAST team, that's the contact tracing, so that once we hear of a positive test, we're following up with people that they've been in contact with, making sure that they don't get out to the community before we have a chance to get them in isolation. And then so the second part would be to look at those individuals who have underlying conditions and who are sitting in nursing homes, other assisted living environments that are vulnerable, and making sure that we test those folks and keep them away from the public. And in some cases, that may even be their own family. So that's section 2. And then the last section is the local testing, the community testing that we talked about. And we have, along with Marcia Foreman and I, have talked about where we might do that. I spoke with Jordan Kohler from HGH. And so we're talking about, we could do a drive-through out at the Indoor Events Center, possibly for testing when we have enough test kits to do so. And so we're just trying to look at some different things. So those items need to be in place. And as I said, 2 of the 3 are already there. Actually, all 3 are there. The only part we'd probably need to ramp up is the community testing, but that's going to be purely dependent upon the availability of test kits. And then the other part of it is already in place, and that's the contact tracing. But the last part that we need to work on, and I've talked to the doctor about this, and I've reached out to several folks, is, you know, what do we do if we're going along, we've started the opening, things are going well, and all of a sudden we are presented with a couple of positive tests, and in the contact tracing process, we find out they came from one store or one restaurant or whatever it may be. Well, we need to have something in place that says we're immediately going to shut down that place or slow it and back it up. We need to have a plan to say, how are we going to arrest that? And that, maybe that's a bad word, I don't mean as law enforcement. How do we stop that from happening? Get in touch with all the people that might have been there. And because we have to have a plan in place to do that. The governor's going to require that, and rightfully so in my mind, because we have to have a plan that says, hey, we have the ability to stop something if it starts to get out of hand. And I feel the other part, one of the reasons I don't think that's going to happen is that when you empower a business owner, having been one in my past in the private sector, that's my livelihood. If my job is to keep my doors open, part of that today, maybe it wasn't in the past, was to provide a safe environment for my employees and my patrons. And that's paramount to what we're trying to do here. And these business owners and the managers that handle these businesses are going to have to take that pride and they're going to have to champion that effort. If they do that, if they require people to distance, they're going to have to break up crowds if they get too close together. They're going to have to make sure that people have masks depending upon the kind of businesses. It's really dependent upon them to do that. If they do that, I think what will happen is the patrons will get it and they'll start to retrain their thought process. To Dr. Stringham's point, I think it's really important that when we start opening things up, people are going to go out and if they want to keep it that way, they're going to have to start changing the way they look at the world. And they're going to have to work with each other and these business owners to do the right thing on their own so that people don't have to ask them to do the right thing. If we do that and we get a few weeks under our belt, I think we're off and running. So that's what I have to say, Chairman.
Thank you. Do you have anything you want to add to that, Dr. Stringham?
You know, I would like to add something, and that is I agree with everything, Dave, that you said. And in addition, what I would say is I would deliver this message to the community, to all those people who are listening. I think that a lot of people look at elected officials or people in the public sector as being different from people in the private sector. And I'd like to point out to each of the members of the community that 40 days ago, I was only a member of the private sector. I've only been in the public sector for a very short period of time. I don't really feel like I'm any different now from what I was before. And my suspicion is that each of you probably feels that same way. I would like to say to the community that we are not the ones, those of us on this board are not the ones who decide what happens. We interpret what all of the members of our community are going to be doing. And we want very much to be able to win, each of us, all the members on this board also, all of us want to win this campaign so that we can get back to our lives. And so it's important for everybody to do the right things. And when we do, we can continue to open businesses and eventually get back to a point where we can have a life that's very similar to the one that we had previously, but with social distancing and doing the right things.
Okay, thank you. Do we have any other questions or comments?
Hello, Mr. Chair, Dr. Stringham and Commissioners. This is Humboldt County Sheriff Mike Allen. Yesterday, we did have a local emergency planning commission meeting, and briefly, we discussed a drive-through pod if we do get the antibody testing, I believe, or the community-based testing. Marcia Foreman, who I did see is on the call right now, brought up a good question. And I know it's not on the agenda, but it could be placed on the agenda in the future. So Marcia, is what I'm asking you, if you can hear me, is if you can come on and just relate your question that you presented at the LEPSI meeting yesterday about who we want to be tested, if you're there.
Yes, I am here. Thank you, Sheriff Allen. So the state has decided that they're going to try to send testing for public health to do these tests. Part of the questions that they have to ask of us as a community, and I think it's this board that needs to be a big part of that, is they want to ask where we wanted to have this, how we wanted to have this, if we wanted to have it in our office, if they wanted to have it as a drive-through, if a walk-through, what type of thing. I think we've pretty well decided the best part of that is to do it as a drive-through in the parking lot at the event center. That seems to be the consensus and the safest for all involved. The other question is, who do we want to test? Do we want to test the essential workers? Do we want to test the non-essential workers? Do we want to test certain businesses? how we want to go about that. The only thing that they have asked that we do not do, they mentioned a first come, first serve. Sean is very, he's been in the know and knows. This is Sean Burke from the emergency management in Lovelock. And that he said when they did a first come, first serve in Las Vegas, they ended up with 4,000 cars lined up with multiple fights, many hospitalizations, police. It was just plain ugly. So that's the one thing we don't want to do is a first come, first serve type, opening it up to the situation. I don't know if we want to do a sector of so many at the mine, so many of the businesses, so many of senior citizens, you know, how we should choose how we need to go about this. The one thing that I do feel pretty strongly about is those of us, so it will be myself and my AAs will be the main drivers of this in the testing, but of course we're going to need the community's help in doing this. And I do feel that those of us that are going to do the testing should be tested first so that the community feels safe and comfortable coming to us. The only questions are, we have no idea of which test we're getting. We have no idea of how many tests we're getting, and we have no idea of when we'll be getting those. I do have a meeting, an emergency meeting that they have called today at 2:00 with my supervisors. So I'm hoping that I'll find out more information then. Does that answer what you were asking, Sheriff Allen?
Yes, it was. Yeah, you said it directly like you said it yesterday. We need to start considering who we want to test. And I think that does need to be presented to the board, and maybe in the future meetings, we can have that item on the agenda. Thank you, Marcia. Appreciate that.
Yes, thank you. I would add that I think we should have that on our agenda probably for each week. And you'll probably have a lot more information a week from now than was available today. Any other questions? Okay, let's move to item 9, Kill COVID-19 Challenge. Recommendation of County Health Officer, Dr. Charles Stringham, to wear a mask at all times when out in public. I will turn that over to you, Doctor.
Excellent. Thank you. I think it's, I want to talk a little bit about masks. And first, I'd like to dispel a couple of different common misconceptions. And in fact, even the Surgeon General of the United States had said recently, stop wearing a mask. And he was very popular in his language, kind of used colloquialisms and was kind of had a very relaxed tone. I'd like to address this. Because number one, there's a very common misconception that's held even at reasonably high levels and some quite high levels that masks do not protect against coronavirus. And that I'd like to say emphatically that that is absolutely false. Masks do two things. Number one, they absolutely do protect against transmission of coronavirus. And the reason that the Surgeon General is recommending that they not be worn is because he's concerned about the medical community and wants to make sure that N95 masks are available for first responders and the people who are actually on the front lines in intensive care units, in emergency rooms, in other settings, wants to make sure that those masks are available. And in that respect, I wholeheartedly agree that that N95s should be given precedence to people who are actually on the front lines. But our community, through the very response, has been designed to combat that issue. And that's why we're making homemade masks, and we're using other types of masks so that we are not taking those masks away from medical people. So that's the issue of availability and whether we should be wearing masks. In terms of whether they're effective or not, I'd like to kind of talk a little bit about how a mask works and the fact that it absolutely is effective. A mask is not going to prevent every single last viral particle from leaving a person's mouth and exiting and event potentially becoming available to somebody else. That's not what it does. Instead, they prevent some viral particles from leaving, but they also have a tendency to slow our breath down as it exits, particularly with coughing and sneezing, but even with other routine speech patterns. And that breath tends to come out and drop more quickly than to go out in a projectile fashion. And so they absolutely do help. They also do one other thing, and that is they help to keep the fight in the forefront of people's minds. It's very common that people, even those of us who are absolutely on the front lines of this fight, can sometimes find ourselves walking a little bit too close to somebody else and then suddenly realizing, wow, I forgot just for a second. So they give you that extra margin of safety, and like a seatbelt or safety glasses or face masks or many other things that we're talking about. So a face mask is absolutely effective. It's absolutely useful. I absolutely recommend that people wear them. It is my formal recommendation. It's not required, but it's my formal recommendation that all members of our community always wear masks when in public. I do, and it's very important that everybody else does too. It's your way of holding up your part in this deal. It's your way also, especially for those of you who've expressed concern and frustration that some people are not engaging. When you put a mask on, it's a very loud and clear comment to everybody in your environment that I'm taking this seriously, and I hope that you will too. We have looked as both a county and a city at ordinances and requiring these, and my preference is that we not do that. I'm hoping that everybody will just comply and do the right things. We can create a social pressure. So my challenge to the people of Humboldt County is, please wear a mask when you're in public. If you can't get a mask, then there are a couple of different things that you can do. You can always call my office and we can make sure that you get a mask. Or you can also go online on Facebook to Mucka Mask Makers, and they can get you fixed up with a mask also. So everybody in Humboldt County who wants a mask should be able to get a mask. So please take my challenge.
Mr. Chairman, I'd like to ask Dr. Stringham a question. I have called a few businesses and I asked them how they were doing with their employees wearing masks. And one said that they have a checker who is actually claustrophobic, has a really hard time with it. What do you suggest for that situation?
You know, some people are claustrophobic and other people just for various other reasons that they can't breathe as well with a mask. And I would say in those cases, I'd like to talk to those people myself. And if a person's not able to wear a mask for one reason or another, they've legitimately tried and they can't, then I don't want to force the issue. My preference would be to have everybody do this in a voluntary way. But I'm happy to talk to people who have a difficult time with masks, and we can help them. In some cases, people may have unknown underlying breathing issues, asthma, COPD, things of that sort. And we could potentially make a diagnosis and help that person. And some people really do have psychological components, such as they really don't like the tactile feel of the mask on their face. I'm happy to talk to those folks. I'll be happy to make myself available for a phone consult with people who have concerns, just to make sure that everybody realizes how serious we are about this. We're looking for solutions. So for those people, they can call me here at my office, or can also approach me on Stop Coronavirus in Humboldt County Now on Facebook. So my office phone number is 775-623-0550, and easy to remember. And then my contact information is available on Stop Coronavirus in Humboldt County Now on Facebook.
Great. Thank you, Doctor.
Absolutely.
Thank you. Any other questions? Commissioner French, do you have anything else? No? Sheriff, do you have anything else you'd like to
No, I don't. All the questions that I had were answered during the meeting. Thank you. And I do want to send a shout out to Nicole Maher. She has been very diligent on what she's providing to us at the county. I know she's sending out emails all times of the day and night, and I just want to extend my appreciation to Nicole for all the work she's doing. Thank you, Nicole.
Commissioner Bell, do you have anything?
No, I'm good. Same with the sheriff said. All my questions have been answered, and I certainly appreciate everybody's efforts to do what they're doing. Thanks.
Thank you. Mr. Mendiola, do you have anything?
Sorry about that, Mr. Chair, Dave Mendiola. I really have nothing really more to add. I would just appeal to, we still have 67 people on the call. And I think the best way to get the word out, especially about the challenge for masking and distancing and those kinds of things, is I would just ask every one of you to reach out to all of your family members, your friends, and just again, ask that they, go out of their way to do everything the right way. And the sooner we do that, I think the sooner we'll stop these daily positive tests and we can start getting back to normal. And again, it's just one of these things that we can do by word of mouth much better than we could ever do through any kind of communication effort. So through social media, the normal routes and things like that. So again, voice to voice is really critically important right now.
Okay, thank you. I have one comment that I would like to make before we move on to public comment, and that is that I want everybody that's on the call today to realize, and you can help get that out, that we are very seriously looking at how we can open businesses. That's something that's on most of our minds all the time, not only here, but as a commission, we'll be working on that as well. And the best way we can do that and help to get our business community back open is for everyone to practice the social distancing, everyone to wash their hands, and everyone to wear masks. If we do that, it'll make it much easier for us to get the business open as soon as the governor makes that exercise available to us. So if you practice those things, I think we can get our business community back open relatively soon. I don't have anything else other than that. Do we have any future agenda items that we would like to talk about?
Mr. Chair, Dave Mendiola. So I do have two items that came out of the meeting. Well, one that came out of the meeting and another that I'd like to recommend. We talked about community-based testing and who should be tested. I gave a brief overview of that. Marcia added some information, but we'll bring that back. We'll have some more discussions. We may even have a little more direct information from the state on this front and or the CDC, because it is a very good question. And as I said, though, I think it's all going to be dependent upon how many tests you have available. So I'll put that on there. And then what I'd like to do is add the under information, and I may just make it a separate item for graphs of the data on these patients that we talked about. Alicia Heiser has done a tremendous amount of work on that front to better understand all the different areas of the numbers of the 40 cases. She's broken it down in many different ways, and I think they all have some meaning and will better serve our community to understand, what we're experiencing. So I thought I'd put that on, and I think the doctor can, speak to those issues, and because there's some very interesting data that comes out of those kind of things. So those would be the two things that I would add to the next one, and then I'll, like I said, do some juggling of the current items we have on there.
Does anyone else on the health board have any items that they would like added to our agenda that haven't been mentioned? No? Okay.
Mr.
Well,
Chairman?
thank you. Yes, go ahead.
Mr. Chairman, this is Commissioner French. I just had a question having to do with the type of testing, the antibody tests, and maybe an update from Dr. Stringham as to not only that particular antibody test and the developments that are ongoing with that test, but also a report on the saliva test that has been recently approved by the FDA, and maybe get a little bit of an update having to do with that particular test as well. Thank you.
All right, thank you. I'll add that to the agenda as well, or Dr. Stringham, you could have some information on that for us, hopefully next week.
Okay.
Okay, public comment. Is there anybody from the public that has joined us today that would like to make a comment? If you do, remember to unmute, and that is *6.
Dr. Stringham.
Would you please identify yourself, please?
My name is Mike Kazorik.
Go ahead.
I'm a patient of yours, and a lot of us are worried about going in for non-coronavirus symptoms.
Mm-hmm.
Is it safe to make appointments and go in for those appointments?
Excellent. Mike, thanks so much for your question. The first thing I can say is that I think it's an excellent question, and I know a lot of us in the medical community are very worried about it. I've talked to Karen, the CEO at Humboldt General Hospital, about this as well. So I know that all of us are really worried about patient perceptions and perceptions of safety. And so I'd like to answer your question and then answer a more general question that's kind of implied by your question. And so the first is that, yes, it is absolutely safe. Not only is it safe to come in, but it's safer to come in than it is not to come in. And I'll get to that in just a couple of seconds. A lot of patients are worried about safety. The numbers of patients who are going into hospitals for other concerns, emergency rooms, clinics, offices like mine, those numbers are down dramatically because people are really worried. And the problem is that some officials, myself included, are concerned that we're having kind of a negative effect of the social distancing and the stay-at-home orders, because it's creating the perception that it's not safe to be out in public, including doctors' offices and hospitals for much needed care and for, in some cases, for emergency care. So, Mike, I think it absolutely is safe to come in. And in my office, we're doing business completely differently. It's one patient at a time in the office. We have only one exam room of 3 that we're using. We never have patients passing each other in hallways. Everything is very controlled. Things are cleaned regularly. Patients always wear masks in my office. If they don't have one, they're provided with one. I always wear a mask. Physical examinations are kept to an absolute minimum and are not routinely done. They're just directed. And so many, many things that we're doing. Our staff is behind glass in the waiting room area. Staff is also social distancing. So it's not just that we're concerned about patient and provider interactions. We're also concerned about interactions between staff members. The hospital is doing exactly the same thing that we are. They're educating the people who work at the hospital from provider level, ancillary level, nursing staff, administration. Everybody is doing the right things. Their surfaces are being washed. Humboldt General Hospital just recently acquired a new device called an ATP detector. And the ATP detector has the capacity, once a surface is washed, to determine whether any pathogens remain on that counter. And the accuracy is just mesmerizing. It's a really neat device. So everybody is working very hard to be able to do this. So the second part of the question I'd like to answer too, second part of what I interpret the question to be, something that I'd like to cover, is that nationwide, we are actually seeing people pass away. We had a case here in Humboldt County where a person came in with really severe COPD, and that person did not survive. And I'm not sure what the outcome would have been if he would have come in earlier, but the perception with COPD is that it's so dangerous to be at the hospital that he chose not to go. And so I'd like to reassure the community that Humboldt General Hospital and my office, West Campus Clinic, each of us are doing everything that we can to make sure that it's safe to be here. And there have been no cases that have been transmitted in my office. I can tell you that the hospital is doing a fantastic job to make sure that things go well. And there are no cases that I know of at Humboldt General Hospital. And it's my business to know these things. No cases that I know of at Humboldt General Hospital where a patient became ill with COVID-19 who did not have that virus before they got to the hospital. So Mike, rest assured, I think everybody's doing a good job to make sure that your concerns and the concerns of others are addressed.
Perfect. Thanks, Doc. I'll see you soon.
You bet.
Thank you, Mike. Do we have any other public comment? Please unmute your mic, *6.
Commissioner Chipton,
Yes.
this is Tom Haas. First of all, I want to thank everybody involved in this and their efforts. What about the tourism that we have in Humboldt County? It's a major source, opening up the businesses here. How are we going to test outside people and try and keep from the coronavirus from coming in? And during the isolation of a COVID virus positive, why are we sending them home instead of quarantining them, say at the fairgrounds or something, to keep them away from all people, even their own family, so that they don't give their family the COVID virus?
I'll let you answer that, Dr. Stringham.
Yeah, Tom, thanks for your question. So kind of a two-part question. The first part is kind of keeping the virus out of the county and testing people outside of the county. And I think one of the things that's so wonderful about the response is that there's a simplicity in everything that we do, and everything can be handled with social distancing, 100% of it. Whether a person comes from outside the community or inside the community. And keep in mind that during the early phases, we were very concerned about people from outside of the community. At this point, we now have more cases per capita in Humboldt County than many of the surrounding areas. And so what I would say is, from a statistical standpoint, travelers are probably safer, have a lower probability, depending on where they come from, of having this virus than local people do at this point. So during the early phases, 40 days ago, that was not the case, but it certainly is now. And we don't routinely test people from outside the area unless they had symptoms. And so far, we're looking at the community-based testing, but so far prior to that, the only people who would be tested would be people who would have high probabilities of having this virus based on symptoms. And so we don't routinely test people who don't have symptoms, but the big thing is we're never going to know who has this virus when they don't have symptoms. And because people are most dangerous before they have symptoms, it is sometimes not strategic to know who has this and who doesn't. It's more strategic to just avoid absolutely everybody. So it's a different strategy, but it's a more effective strategy. And then in terms of the second question, sheltering in place in a residence versus sheltering at a predetermined location, such as the Humboldt General Hospitals and the community's field hospital that's set up, auxiliary hospital set up at the event center. And what I can tell you is there is some validity to the opinion that we should isolate people, put people into respiratory isolation in an official environment. But what I would tell you is that also has an entire litany of risks as well. We can't eliminate risks. We can only relocate those risks. So when you put people into isolation at an event center, you would be presumably putting people who have the virus, who've already been proven to have the virus, and people who are merely in isolation because they were in contact with somebody who had it. So bringing those two groups together is not a very good idea. The other thing is we're already having problems keeping people engaged in the community, and to essentially put somebody into a facility, my feeling is a lot of people wouldn't want to go. I've talked to most of the people who have who've been exposed or involved either directly or through our FAST team or through the state. And what I can tell you is that it would be a difficult sale to convince people who need to be in isolation that they need to uproot themselves from their homes. And that would bring up the question as to whether we needed to put them into legal holds, which brings up a whole other litany of issues. And there's question as to whether or not formal isolation at a facility would be better than isolation at a residence. I can tell you we've had quite a number of people in residences. In fact, most people who've isolated in residences have not infected other people as long as they've followed our guidelines. So your question, I like your question. And I think that in the end, I don't think it would eliminate risk or minimize risk. I think it would just relocate that risk and cause us to have to deal with a litany of accessory issues.
Thank you, sir.
Thank you.
I appreciate your input.
Do we have any other public comment? If so, please unmute your mic, *6. Is there someone trying to get on? Hearing none, I will move to make an adjournment of this meeting at 10:46. Thank you very much. We'll see you next week. Oh, back up a minute. We forgot to set our meeting date. Our meeting date will be next Thursday at 9 a.m. Now we'll adjourn the meeting. 10:46.
Thank you.
Thank you.
Thank you, everyone.